Prostate cancer is the second most common cause of cancer-related death in men. There are many signs of prostate cancer, risk factors, and treatment options that you should be aware of. First, let's take a look at risk factors. So risk factors include age greater than 50 years old, a family history of prostate cancer, and genetic mutations. So a person can have a genetic predisposition to prostate cancer if they have mutations such as a BRCA2 mutation, and this can cause an aggressive cancer. It's also very important to note that prostate cancer is more common in African American males. Advanced age is the main risk factor for prostate cancer. So all men must ensure they do their annual physical with their doctor to screen for other illnesses and for cancer-related illnesses. They can also discuss any symptoms that they are concerned about or have developed. So this is especially important for patients that have a family history of prostate cancer, who have a genetic mutation, who are increasing in age, or African American. Now let's discuss some myths about prostate cancer. So some people think that sex or frequent sexual activity can lead to prostate cancer, but this is a myth, and this has been disproven by research articles. So there's another condition called benign prostatic hyperplasia, and sometimes it's confused that this condition can lead to prostate cancer, but that is a myth as well. It is true that benign prostatic hyperplasia and prostate cancer can have overlapping urinary symptoms. However, having an enlarged prostate or benign prostatic hyperplasia does not mean that that patient will develop prostate cancer. To find a more in-depth analysis and comparison of these two conditions, you can click this video right here. Also, if you're liking this content so far, be sure to power up the like button and hit subscribe and that notification bell so you don't miss any more videos like this. So prostate cancer is very slow growing. So patients with early prostate cancer may not have any symptoms at all. However, once this cancer substantially increases in size, then prostate cancer signs can be seen. So these signs can be divided into three main groups: constitutional symptoms, localized symptoms, and metastatic symptoms. Now let's look at the first group of constitutional symptoms. So patients can experience symptoms such as fever, weight loss, and decreased appetite. These constitutional symptoms are not specific to prostate cancer. They can be seen in pretty much all cancers that you can think of. So let's look at something a little bit more specific for prostate cancer, and that's the localized symptoms. So these localized findings are mainly urinary symptoms. So first, you can experience blood in the urine or hematuria, urinary retention, and flank pain or renal failure if there's involvement of the kidneys. Other symptoms include blood in the semen or seminal fluid, frequent urination, and the sensation of incomplete voiding or incomplete urination. So let's say you went to pass urine, afterwards you could still feel like you have not successfully passed all the urine. They can also experience a weak or interrupted urine flow, or even the need to strain to empty the bladder. A much less common sign is pain or burning during urination. Patients with prostate cancer can also experience erectile dysfunction. So, for these localized symptoms, be sure to look out for urinary symptoms, blood in the urine or semen, and erectile dysfunction. So, we discussed the constitutional symptoms and the localized symptoms. Now, let's move on to the metastatic symptoms. So, these can include bone pain due to mets to the bone, enlarged lymph nodes, or weakness due to spinal cord compression. So, the first step in diagnosing prostate cancer is a physical exam that includes a rectal exam. So, a normal prostate is usually smooth, symmetric, and painless. However, in advanced prostate cancer, the prostate can feel asymmetric and even have nodules on it. So let's move on to labs. So we have a marker called prostate specific antigen. So doing this test is a bit controversial and inconclusive for prostate cancer because low levels of PSA do not rule out prostate cancer, and elevated levels of PSA does not necessarily mean that you have prostate cancer. An elevated PSA can be due to manipulation, infections such as urinary tract infections or prostatitis, and due to BPH, which we talked about earlier, which means benign prostatic hyperplasia. However, there has been some use for PSA to follow recurrence of prostate cancer. So if you have a PSA positive prostate cancer, then it could have some use to monitor recurrence like after receiving treatment. And also another important lab is alkaline phosphatase. So this may be elevated if there is bone mets. So leave a blue heart in the comments below for all those that have been affected by prostate cancer. Both of my grandfathers passed away from prostate cancer, so I really hope that this video can be helpful and provide as much information as possible for those that need it. So we talked about the physical exam, the rectal exam, and the PSA and alkaline phosphatase. So now we need to go more into diagnostic tests for prostate cancer. The best diagnostic test is an ultrasound guided prostate biopsy, which is done under local anesthesia, and at least 12 biopsy samples are taken. Then you can determine if the patient has prostate cancer, what type of prostate cancer, and we can also grade it using something called the Gleason score. So we diagnose prostate cancer. So what's next? That is the treatment. So the treatment depends on the age, stage, preferences of the patient, and coexisting medical conditions. These are all essential factors to bear in mind before initiating treatment. So you have medical management of prostate cancer. These include drugs such as leuprolide, which is a GnRH agonist, or flutamide, which is an anti-androgen medication. Prostate cancer may be influenced by the effects of testosterone. So to understand the pathophysiology behind this, be sure to watch my video comparing BPH and prostate cancer when I get into depth and explain the pathway of DHT and testosterone and the interventions to treat them. Finally, we have surgical management of prostate cancer. So if surgical management is required, it involves radical prostatectomy, or radiotherapy as well. So, during a radical prostatectomy, the vas deferens is removed, and this can result in infertility. Other complications of this surgery may include erectile dysfunction and urinary incontinence. But remember that the treatment option that's best for you depends on age, stage, preferences, and medical history or prior medical conditions of the patient. And that brings us to the end of this video. If you have any other helpful tips or information that you'd like to be added, be sure to mention them in the comment section below. If you liked this video, power up the like button, hit subscribe, and that notification bell. As always, thank you so much for watching, and to continue learning more, click this video right here. Bye!